periodontal disease?
No.
Okay, well, let me tell you about it. Give just a moment of your day. You need a breather anyways. So periodontal disease is what happens when your tooth becomes infected, the gums, and it's an all-encompassing term. It has 2 stages, okay?
Okay.
First stage is gingivitis, and that means that there's inflammation. Your gum tissue is going to look red, they'll be soft, spongy. It's a reversible condition. You can recover from this.
Good.
Yes. The second is periodontitis. That means the gums begin to shrink and pull away from your teeth, and as a result, there's bleeding. Sometimes you can just lose the gums, and destruction of the bone in the jaw, most importantly. This is a non-reversible condition.
That doesn't sound very good.
So,
how do I make sure I don't get it?
There's some different risk factors and some preventive factors that I'll go over with you. So in gingivitis, I kind of already said the gums appear larger above the normal gum line. That'll mean they're kind of swollen up. They usually are red, round, fat, swollen, and there's bleeding whenever you're flossing. So in periodontitis, it can look several.
Floss.
Well, you should be flossing because you don't want to get periodontitis, which is the next thing we're going to talk about. So the tissue can appear different ways. So you can be spongy tissue, which will be bluish red or purplish red, and it'll kind of have a smooth, shiny appearance. It can be firm or hard tissue. This is harder to detect because it looks like pink and has a leathery consistency. The gums may be less tight and more spongy around the teeth, and they may not even fill the spaces. Bleeding can occur with possible pus when there's any pressure placed on it. So if you're just pushing on it and pus comes out, chances are you have periodontitis.
That's not good.
Okay, so the good news is you're young and age. Older people have higher chances of getting the disease.
But I'm gonna get older.
I know, but there's other things too. Gender. Males have a greater chance. You're safe there. And severity of the periodontal disease. Tobacco smoking, that has a bad effect on the gum tissue.
I don't smoke or chew.
Good to hear. And it's related to many diseases, which causes xerostomia. That means dry mouth. Medications. Are you on any medications? No? Okay. Certain medications can dry out the mouth, causing the tissues to become unhealthy. And lastly, systemic diseases lower the body's ability to fight off that inflammation and infection. And these can be certain diseases such as diabetes or arthritis. They're linked to the health of the gums. Some local contributing factors is faulty restorations, which are fillings and crowns, and then areas with crowded or misaligned teeth. Did you have braces?
Yeah, I mean I did.
Okay.
So my teeth aren't crowded.
Okay.
So that's good.
Okay. Here's some preventative factors you can take. You want to avoid smoking. You said you didn't, so that's good. Don't want to use tobacco. There's some different programs and products that are available if you need to stop. If you're lying to me, and you really are, you want to maintain good home care, so brush twice a day, floss once a day, and rinse with a mouthwash daily. And then lastly, you want to use interdental aids. So there's lots of interdental aids, such as water pick, which is that thing that shoots water around your gums, various types of floss, and then perio aids. So, and also you want to consider the use of Biotene, which is a type of fluoride toothpaste. There's a picture right there. And as a mouthwash or a toothpaste. And there's a picture of the Biotene. And then, last but not least, we've got some references, some good sources that you can go and look at and read that information for yourself.
Okay.
Thanks for listening and have a nice run.
Okay.